Hello everyone. I'm Dr. Dhanlaxmi, consultant UA Skin Clinic, practicing at Chennai. I mainly practice in clinical dermatology as well as aesthetic dermatology. Today, we are going to have some information about acne scar treatment. This is acne is of course temporary. It comes and go, but it won't go without leaving mark. If you take in 100% of the acne patients, at least 45% of the patients will have a leftover acne scars. The scars may be different in type, and before that, the age group also important. Most of them they come very late after acne is subsided. They come with literally scars. So that time we have very minimum to do. So it is important is very early to treat the acne, mainly to prevent the scars. So 1 ounce of prevention is better than too much of scars prevention. So it's always go for an early treatment of acne. Who will get acne scars? That is the important question. Everybody asks the thing. One is more inflammatory acne. That is very big size acne, reddish in color, and it forms more pus, and it is we call it a cystic acne, big bowing like things. And also people have on the back, arm, all those people are very prone for the scars. So earlier the treatment, we can prevent to some extent of the scars. That's why we insist on treatment of the acne. So usually our grandma says acne is very common for this age. There's no need for treatment. Don't medicate like that. It is not true. That's a myth. So that it is better to start the treatment early. So what is the early treatment? When the patient comes adolescent, that is that time we give very minimum medication. We advise slight lifestyle modifications like thorough washing. That's cleansing is very, very important in the acne treatment. So thorough cleansing, and we give wherever necessary topical antibiotics and topical some anti-acne preparations, and then only we go for oral medications for a young adult, young adolescents. Then once the acne established that it is going to give a scar like that, we get some signs like more inflammation, more redness, more swelling. Some of the patients they tell they cannot wash the face because it's paining when they wash. Those patients they need definitely very aggressive and definite treatment for the acne to prevent the scar. This is the first line of treatment for acne scar. That's before it causes damages the skin, we have to treat. That's the basic. So cleansing is very important. Treatment of acne is very important. Then next thing is maintenance. So like even sunlight damage can increase the acne scar chances. So that sun protection is part and parcel of acne treatment as well as the acne scar treatment. So they have to continue with the sunscreen. Now we come to the acne scar as such. The scar is real aftermath of acne that gives lot of psychological impacts on the patient's life. One of my patients who is attending the college, he stopped going to college for the last 6 months because of the severe acne scar. All his colleagues are always pointing about the person with the scar, that boy with the scar like that. They are identifying him. That's why he stopped going. And when they come to me, still he is getting acne. So first we have to treat the acne, then start treatment for the acne. It's very difficult to treat the acne scar. That's why we insist on our young patients to get the treatment for acne first. Then it is easy to treat the acne scars. So after treating the acne, once the acne subsides, at least 90% of the reduction of the acne comes down, that's time we start with the acne scar treatment. So again, as I told, maintenance like cleansing and sunscreen, then we start the acne scar treatment. The sunscreen is very, very important in maintaining the scar treatment and during treatment also. So the scar types also important in treating the patient. So the scar types there are so many types. One is called atrophic type. Atrophic type is something, the defect in the skin, which is stepped down from the skin. That's called atrophic scar. That also have so many types like the ice pick scars and box scars and also rolling scars. Ice pick scar is like a V-shaped scar which is pointing down into the skin. That is, the patients always mention as it is a white pores. It is actually acne ice pick scars. They mention as a white pores. The next thing, it is a wall scars. It is a punched out scar like. The next thing is a rolling scar. Since two scars nearby join together, it forms like a M-shaped scar or W-shaped scar, like it is called. Then next thing is this all destruction of the tissue causing the scar. Next thing is overgrowth of the scar tissue. That's called hypertrophic scar or keloid scar. So that is a problem. Luckily, this hypertrophic scars are not occurring on the face. Most commonly, it is seen around the jawline as well as on the back, on the on like on areas like that. So that is not much a problem in acne scar patients. So mostly the atrophic scars. So what are the treatment modalities available for atrophic scars? It is not that much easy. You cannot correct 100%. That's why we insist on prevention of the scar by treating the acne. We can make it not perfect, but definitely improvement of the scar. Nobody can get back the normal skin after scar treatment, but at least 50 to 70% of the improvement of the scar is possible. Next thing is the deeper scars. So it's called moderate scars. Those scars needs procedural treatment. We cannot do only with the topical creams. We have to go with the procedure. One of the commonest procedure, actually it is underused by most of the practicing dermatologists, that is called subcision. Subcision is nothing but elevation of the scar. So we just from the base, it is attached by the fibrous tissue to the base of the skin, that is the dermal tissue. So we have to release the fibrous scar tissue to elevate the scar. So to some extent, 50% of the depth can be reduced by doing subcision. Subcision is something like before painting a wall, we make all the small crease, small elevations, we make it flat. Like that, subcision is helpful. Then after that, we can do even piece, the scar bases discolored, we can do chemical beads. And next thing will be the we call it as dermal. Dermal is nothing but it induces the collagen. So those things are not in one sitting. We can produce any improvement. It needs multiple sittings, like every month or every 6 weeks, like that. We have to allow some time for the collagen to modulate. That's a 6 weeks minimum time we give it. So some of the course beauty parlors, some of the other things, they do every week dermal. But superficially done dermal, that is not much helpful. It cannot attend the scars deep, which is almost 1.5 millimeter enough. So we have to do the appropriate depth dermal and appropriate interval between two sittings, and in between also two sittings we have to take care of further acne and further sun damage which can worsen the scar. So all those things to be taken care by the dermatologist. When you open the YouTube or any other platforms like cosmetological things, you can see so many preparations which can make your scar overnight better. It is definitely not possible. Don't go with those things, because so many students or the young patients, they come with that. They buy the dermolar by own by seeing the net. There are videos that is given by non-dermatologists that is wrongly direct them. They come with the infection, they come with more scar, because when wrongly used, the dermatologist gives more pigmentation. That is another problem we see in our practice. So this is all not advisable. So self-medication in anything, even if I'm a dermatologist, if I have some eye problem, I should go to a ophthalmologist. Not I can myself by reading the YouTube or reading the journal. I cannot treat my eye problem. The only ophthalmologist can take care. Like that, the patients who have acne or acne scar never go with advertisements or never go with YouTube teaching. So for practicing medicine as well as practicing a dermatology or dermatology surgery, definitely a doctor need a practical exposure as well as a thorough scientific knowledge about the scar, collagen formation, how the scar can be rectified. Next thing is, people come to my clinic, they come immediately, doctor, I want a laser for my scar. They think The laser is the ultimate cure for the scar. It is not like that. It is not a magic box or magic bullet to reduce the scars or to stop the scars. After doing subcision, after reducing the pigmentation, after giving thorough information about sun protection and further scar and further acne prevention, then only you can take the laser. All the beauty parlor procedures, we are giving temporarily better looking skin. No harm if you go for a party or you go for a function. You want to have your face in a better way, you can dress up like a beauty parlor things. But those are not permanent remedies. Those can give you immediate good looking. You can go for that, but never combine with our procedures immediately. At least 3-4 days gap, minimum 3 to 4 days gap. And some of the lasers, we advise minimum 2 weeks interval between this procedure and those beauty parlor procedures like your makeup or so many things they are doing there. Those things to be taken care. So I hope this information regarding the acne scar treatment will give you some highlight about the further how to go with that. And if you are interested in these things, you can search for the site for the further informations and the further updating of this acne scars treatment further. Thank you.
For more such videos, visit or log into dermavidya.com.